Hello, my name is Rebecca Scully, and I'm a dental hygiene faculty member at the UT Health School of Dentistry, School of Dental Hygiene, and I'm going to be guiding you through this module on learning how to provide oral hygiene care to your loved ones as part of the Learning Together program that you're in. What I'm going to be discussing over the next few minutes is proper toothbrushing or denture cleaning techniques when you're assisting your family member with oral hygiene practices. There's a video that is separate of this presentation that shows proper hand-under-hand guided toothbrushing technique that you'll be viewing independently. And I'm also going to talk about ways to help your family member increase receptiveness to oral care and helping, hopefully to help you build your confidence in identifying and locating adaptive aids and oral hygiene products based on your family member's individual needs. There are a lot out there, so I hope to sort of narrow some of that down for you, make it a little bit easier for you to make the selection based on what your particular loved one needs. So let's just get down to why oral hygiene is important. I know that as your loved one's dementia diagnosis progresses, then things get progressively and sometimes rapidly harder and harder when it comes to ensuring if they are brushing their teeth, and then also if you need to help them, that is going to be harder for you. So I just want you to understand why you're doing this for them, and maybe that'll make things a little bit easier for you whenever you are having some of those days where your family member might not be very receptive to care. But one of the things that's very important to know about oral hygiene is that you can actually develop a fungal infection, gum disease, dental disease, and eventually lose teeth caused by different issues that can be prevented with simple daily oral hygiene care. You probably know that you can have gum disease or cavities that lead to tooth loss, but fungal infections can result from denture wearing, and we'll talk about that a little bit later on. Another reason why oral hygiene is important is because you want your family member to maintain their ability to chew, speak, and swallow, which can get lost or compromised if they start to lose some of their teeth. Another thing that can happen with the inability to chew due to tooth loss is that they might inhale or breathe in their food. So you want to help them prevent that. That aspiration of food is what it's called, and also plaque. So you can breathe in that plaque that's on our teeth that we brush off every day, and it can cause problems called aspiration pneumonia. So that's when you breathe in something, but in this case it's plaque, and breathing in plaque is the #1 cause of aspiration pneumonia. Maintaining proper oral hygiene also helps to control diabetes, prevent malnutrition, and maintain heart health due to reducing the level of inflammation in the body. And then finally, and I think most importantly, is maintaining oral hygiene helps people keep up their self-esteem and morale by improving their outward appearance. I think we all want to have a nice, beautiful smile, and those who don't feel like they're beautiful are not going to smile. So this is just one of the many things that we can do to help improve morale for your family member. Let's go over some techniques for proper toothbrushing and denture cleaning. So on this activity, I just kind of like you to pretend like you have a brush, or if you have a brush, and just practice, if you look at the picture there, holding the brush to your gum line. If I had a toothbrush right here, I would show you, but you might not want to see that either. So let's just use our finger. And you can envision the bristles are actually touching the gum line. So that's right where the teeth and the gums meet. You want to hold that bristle at a 45-degree angle, and you want to use these little circles, not very far, just little circles, no scrubbing, but little circles like this as you come from the back to the front. You get to the front, on the inside you use the toe. That is the part that is at the very tip of the toothbrush head. Here's the heel, and here's the toe. So use the toe to get in the back side, clean here, and also down on the lower front as it shows on the last picture there. So outside, all the way across, inside, come around, use the toe, go all the way around, and then brush the tops of the teeth, where the part that we chew on. So you'll want to do that, spit your toothpaste out, and then start again on the bottom teeth. That should take you about 2 minutes. Now with your family member, your loved one, if it doesn't take 2 minutes just because they're not going to tolerate that, that's okay. You can spend as much time as they'll let you. Anything's better than nothing at all. Now for a denture, it's very important to remember to remove that denture or the partial denture daily and brush it after every meal. And then at night, you want to rinse that denture or soak it for about 5 minutes and a denture cleaner, brush it off, but keep the denture in water overnight. So I know people tell me, oh, I don't do anything, I just set it aside. Well, what happens with that is the acrylic that's on the denture gets very brittle, it can break, and it also harbors bacteria, which can make it smell bad and then go into the mouth, which then goes into the body, and then that's not healthy. So you always want to make sure that if you keep it, just like it shows in the picture, in some water overnight. You don't have to keep it in the denture solution. That only takes about 5 minutes. You brush it off, then you put it in clear water. That's all you have to do. But do make sure that that the denture is wet when you put it back in, whether it be your mouth or your family member's mouth. Okay, so sometimes brushing teeth is not anybody's favorite thing to do, let alone if you are having cognitive problems. So I want to just offer a couple ideas to help increase receptiveness to toothbrushing. Some of these are similar to what you might have heard when talking about ways to make mealtime a little bit easier. But one thing you can do is turn off the TV and other louder distracting sounds. Instead, put on some relaxing music, something that they're not going to see and it's not going to be very loud to them, just very relaxing. You can gently hum or repeat the words brush, 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 or if you know that your family member has a favorite song that they like that calms them down, you can sing that song while you're helping them brush their teeth. If your family member is sitting because maybe they can't stand, put a weighted blanket across their lap, and that tends to help create a little bit more of a calming environment. Try to perform oral hygiene care, basically brush their teeth at the same time every day. If they're a morning person, do it in the morning. If they're an evening person, do it in the evening, preferably morning and evening. But again, if it can only be done at one time or the other, that's okay too. If possible, you can have, if you have somebody there to help you, you can let that person help you by massaging your family member's hands or brushing their hair or even taking over and they perform the toothbrushing if it's not going very well. And then also, last thing is you can give your loved one an extra toothbrush to occupy their hands and to prevent grabbing. So they hold onto the toothbrush in their hand and they look at it. Maybe they're going to try to help, but then you have the toothbrush in your hand. And of course, this is only if they need help brushing. If they don't, then you can just kind of oversee them while they're doing it, if they'll let you. Now, another thing is when you're guiding somebody to do their own toothbrushing is offer precise directions. If they're a little bit confused about the process of putting the toothpaste on the toothbrush, demonstrate that act, explain it as you're going, but use simple words and sentences. Break it down, like now you're going to hold the brush. Now let's put some toothpaste on the brush and then go ahead and put the brush in your mouth. And then now brush your back teeth, brush your front teeth. Just really break it down into steps. You might even have to tell them spit, rinse, and then just start over again. But offering those precise directions is going to make things a little bit more clear, less confusing. Now, a couple products that might work for your loved one, I'm going to go into next. One of them is called the Kalos Curve Toothbrush. As you can see here, the bristles wrap around the outside, the inside, and then you have some that even brush the tops of the teeth. So if timing is just not on your side, then you can use this brush in just a real quick, again, not scrubbing, but just short strokes going from the back all the way around to the front and then all the way around to the other side. And if your person that you're caring for has gum recession, there is a long bristled version available. So on the Collis Curve, you should be able to do a quick Google search of Collis Curve toothbrush. It comes up. I think you can buy it on Amazon in packs, and it really does help save that time that you might not be afforded right now. Another thing, if your loved one is starting to experience their inability to grip their toothbrush, is you can make your own grip enhancer. You can see here the black handle, that's a bicycle handle, as you can tell. You can heat up the handle and bend it to where they get a better grip. A lot of toothbrushes are now available where they have a larger grip, especially an electric toothbrush, and those are really, really great too if the sound of the electric toothbrush doesn't bother them. So this helps people who not only have dementia, but if they also have some arthritis and they can't close their hand around the brush. And like I said, you should be able to find these online. Are the A couple other products I'd like to talk about in addition to the Collis Curve toothbrush are the end tuft brushes, which help get way, way in the back if your loved one just has one single tooth back there. Another is this Sonicare product. It's not a toothbrush, rather it's a little water flosser that squeezes water between their teeth. And you use that in lieu of flossing, where I think flossing might be a little bit too hard for your loved one, if that's the case. And then you have these little interproximal or interdental brushes that fit in between the teeth kind of nicely as long as their teeth aren't tight. And then as far as toothpaste, there's a couple on the market that don't contain fluoride. If your loved one has a tendency to swallow or they aren't able to spit very well, then you can try the Colgate children's toothpaste, or Spry also makes a toothpaste that is fluoride free. Um, if you don't want to use toothpaste because you're really too worried about it, you can try this dry mouth gel that you can actually, I've brushed people's teeth, people living in nursing homes, I've brushed their teeth with this Biotene gel before, and it actually works really well at getting the plaque off. But on the other hand, if your loved one is cavity prone, and they have no problem spitting out, then this Colgate Prevenant 5000 booster has a high amount of fluoride, and it helps to remineralize their teeth and prevent cavities. And that would be a good one to use if they are cavity prone. And lastly, my picture is covering this up, but over here, kind of superimposed behind me, is a Biotene dry mouth mouthwash. And this is a good product to use if your loved one is having a really hard time with dry mouth. But again, if they have a tendency to drink or swallow everything that's handed to them, then you don't want to use that. Or if they cough and choke very easily, you don't want to use that as well. I would go for the gel. That's the safest in that regard. I want to thank you for listening to this short presentation about oral hygiene care for your loved one. I appreciate your attention and I wish you all the best. Thank you.